decontamination. So decontamination, according to Occupational Safety and Health Administration, OSHA, decontamination is defined as the use of physical or chemical means to remove or inactivate or even destroy bloodborne pathogens on surface of the item to a point where they are no longer capable of transmitting infectious particles. So this is called decontamination, so that it is then useful, it is possible for others to handle it, use it, or even dispose it. Okay, so in decontamination, you have to inactivate or destroy the bloodborne pathogen. And after decontamination, other means of reprocessing can be followed through. Okay, so you remove and destroy any contaminants or infectious agents. Okay, to a sufficient quantity that it cannot infect somebody else and it is not harmful to anyone else who is going to use it. Okay, so that is the process of decontamination. So once the instruments or other items has been decontaminated, only then they can be processed. You cannot send the instruments without decontamination for sterilization or any level of disinfection. It has to be decontaminated first, then it will be cleaned, then either sterilization or high level disinfection can take place. You can see here in the picture image given, decontamination is the first process. Okay, so imagine a surgery is going on, surgical instruments that you have used have blood, body fluid and tissues over them. Okay, you do not send those equipments with that blood stains to the CSSD. Okay, what you do soon after the surgery, what you do with that instrument is the process called decontamination. Okay, some enzymatic cleaners are used in the OT itself. You scrub it off, you decontaminate it, dry it, then it is sent for the CSSD. They will clean it, sterilize it, high level disinfection of whatever has to be done, it will be done. Okay, soon after using an instrument which has blood, body fluids, or which has contacted human body, what you do to it so that it is safe for further reprocessing, that action part is called decontamination. Okay, so tips for decontamination. So use a plastic container for decontamination to prevent dulling and rusting, because the enzymatic cleaners that you use here for decontamination, they are very harsh on metals. Okay, on long-term use and on regular use, it can destroy the metal. It can cause rust and dulling to the metals. So that's why plastic containers are used for decontamination. And do not soak the metals that are electroplated. Certain instruments, certain surgical instruments are electroplated. So do not soak them in these enzymatic cleaners. Otherwise, it will start to rust. Then chlorine containing disinfectants should not be mixed with acidic cleaning solution because it will release the chlorine gas. Okay, so even bleach powder and acid should never be mixed together. Any instrument that has been decontaminated using the bleach solution, okay, or chlorine solution, it should never touch acidic cleaning solution. Otherwise, it will lead to the release of ammonia gas or chlorine gas. Okay, and if at all by mistake you are mixing these two solutions, Leave the room immediately, open all the ventilation, okay? Leave the room immediately if you are exposed to chlorine gas or ammonium chloride gas, okay? So how do you prepare this decontamination solution, okay? Disinfectant cleaning solution. So 5% chlorine solution can be used. WHO has also mentioned that 0.5% chlorine solution can be used for decontamination. How do you make this 0.5% chlorine solution? You have to take 1.5 liters of water, add a little less than a tablespoon of bleaching powder. Okay, stir it for a few seconds. Your 0.5% chlorine solution is ready. Okay, you can make it every day, but you have to use it up within that day. Do not use old chlorine solution 0.5%. Okay, every day it is better to make it on a daily basis. If it is 24 hours old, you have to throw it away. Okay, so 1.5 liters of water, just 1 tablespoon of, little less than a tablespoon of bleaching powder, chlorine powder. Okay, your 0.5% chlorine solution is ready. Okay, so instruments that you have used on patients which has blood on it, body fluids on it, dip those instruments in this solution, in the 0.5% solution. Okay, rinse it thorough, and then you can add some detergent as well on top of it if you want additional cleaning. Okay, add some detergent on it that can foam. Detergent means what? It can foam. It has surfactants. Okay, detergent has surfactants. So take one bucket of 0.5% chlorine solution, dip all the instrument in it, add enough detergent on it, or if you want to use any other disinfectant like Dettol, Savlon, that does not have any ammonia. Okay, that does not have any acid, non-acidic disinfectant can be added to the solution. Dip your instrument in it, okay, for 10 minutes. Remove it, then dip it in cold water, okay, to remove this detergent and chlorine solution, bleach solution. Okay, then you can send it for CSST. Is it clear how to do the disinfection or decontamination? So preparing household bleach at home, if you want to prepare a bleaching solution, what can you do? So if there is a large blood spill in hospitals or anywhere, you want to disinfect that area, 1.10, 1 is to 10 dilution is required. That is 1 part of bleach in 9 parts of water. Even if it is 1 tablespoon, even if it is 1 tablespoon, 1 bottle cap, 1 cup, okay, you have to use the same amount of both bleach as well as water. Whatever size of the mug you are using to take bleach, that same size mug has to be used to take water as well. Okay, so 1 part of bleach plus 9 parts of water, you get 1 is to 10 dilution, okay, of bleach. This can be used whenever there is a large blood spill, usually in operation theaters, where emergency departments and all, where you expect large blood spill. Okay. ppm is parts per million. ppm stands for parts per million. Okay, that is the chemistry formula that you don't have to remember. Okay, what you can actually practice it. 1 part bleach, 9 parts water. This is what you can do. Okay, parts per billion, no need to remember those. Okay, And in terms of ml, if you want to see 25 ml of bleach in 25 ml of water, that will give you 1:10 dilution, or 5 teaspoon bleach in 1 cup of water. And the contact time between this large blood spill and this bleach solution should be 20 minutes. Okay, you have to pour the bleach solution over the large blood spill for 20 minutes, leave it as it is, and then the housekeeping staff is advised to take it off, to clean it away. Okay, after this contact time. If it is for surface cleaning, okay, like wet mopping and all, cleaning the tables, chairs, bedside lockers, bed rails, handrails, okay, wherever the patient has used for surface cleaning, you want to disinfect. 1:50%, 50 is the dilution. So 1 part bleach, 49 parts water. Okay, so 10 ml of bleach in 490 ml of water. So you will have half a liter of bleach solution. 1:50 of bleach solution. Okay, or 2 teaspoon bleach in 2 cups of water. That will also give you the same concentration. 10 minutes contact time is given, and it is ideal for bedside locker, bed rails, hand rails, and all, whichever the patient has touched after the patient gets discharged. This dilution can be used for surface cleaning to disinfect the entire area, making it ready for a new patient. Then if there is a minor blood spill, 1:100 is the dilution. 1 part of bleach in 99 parts of water. If in ml terms, milliliters term, 5 ml of bleach in 495 ml of water. Okay, so that will give you this dilution. Minor blood spills, only 10 minutes is the contact time. And after that, the housekeeping staff can clean it off. Okay, so this is how you prepare different levels of bleach concentration based on for what purpose it will be used. Okay, is it clear to all? Yeah, based on the hospital policies also, this can change, but this is the standard what we use regularly. But hospitals can have their own policies as well. Then disinfection of OT. So fumigation using formaldehyde is no longer practiced, okay, because it is very harmful. It's a formaldehyde solution is very irritant, okay. It irritates the eye mucosa, nose, okay. Difficult for the staffs to work in a formaldehyde fumigated area, okay. So fumigation can be done in high risk areas like ICU, PICU, NICU, but now we use 2% bacillocid solution, not formaldehyde. Okay. So what is 2% bacillocid solution? Just take 100 ml of this solution, put it in 5 liters of water. Your 2% bacillocid solution is ready. Okay. So bacillocid solutions you get in this cans, take 100 ml of it, put in 5 liters of water, your 2% this thing is ready, and you can use this bacillocid solution for cleaning purpose, mopping purpose as well. Okay, but if you're doing fumigation, the room has to be closed for 6 hours. That's it. If formaldehyde solution is used, it is longer time. 24 to 48 hours and all, you have to close the OT or ICU. Okay, you lose a lot of money in that. So here, if you're using bacillocid solution, just 6 hours is, if the room is closed, that is more than enough. Okay, for fumigation. And for cleaning the wall surface, mopping, okay, will be done. Yeah, you have to wipe the solution over the large blood spill. And then it is cleaned with either plain water or any other form of disinfectant. Okay. The first contact should be with the bleach dilution. The second contact will be with any disinfectant solution. Okay, you can use this same disinfectant as well. Wherever blood spill is there, you allow the bleach solution to have its contact time. Then you can wipe it off using any other disinfectant. Okay. It comes in different brand names. Okay. Brand names will differ. Just see the content of it. Envy Shield, Sterigen, these all are different brand names. You can see the content of it. The purpose of it is mentioned on its boxes or cans. So fogging has been widely accepted as an alternate methods for OT. Okay, instead of fumigation, now it is fogging because quickly it will give you the result. Okay, it is not that labor intensive. It is quick as compared to fumigation. And it does not have any health hazard to the staffs as well. Okay. Fumigation, your eyes will irritate, it will water, tear up, you will cough, it will affect your mucous membranes in your eyes, your throats, your nose, everything gets affected. So it's a health hazard. Okay, it's a carcinogen as well, formaldehyde. When it comes to fogging, the fogging solutions are much more milder on the healthcare person's health. Okay. So fogging is used nowadays. It is less labor intensive. It gives you quick results, good results. Okay. Microbiological sampling and surveillance of OT is also recommended at least once a month. Take samples of the floor, corners, air vents from the OT, send it to the laboratory for test to see what kind of microbes are present in your OT. Okay, if there are any harmful microbes, you can take precautionary methods. Okay. Then we have the splotting classification. Splotting classification helps you to categorize instruments used on patients. Okay, based on its criticality in transmitting infections. Okay, so three classification is there. Three categories are there: non-critical, semi-critical, and critical. Non-critical are the instruments that only touch your upper surface of the skin. Okay. It is not touching any wound. It is not touching any mucous membrane. It is not touching inside of your body. It is just touching an intact skin on your body, on the patient's body. That is non-critical instruments like your stethoscope, sphygmomanometer. Okay. Thermometers, auxiliary thermometers, not oral, not rectal, auxiliary thermometers, pulse oximetry. Okay. These are the devices which are touching intact skin. NIBP, cardiac monitors. Okay. They are touching the intact skin. You don't place stethoscope on a wound. You don't place a sphygmomanometer's cuff on a wound. Okay. Or an abrased area. Okay, on intact skin only you will place these instruments. So they are non-critical devices. They don't have much risk of transmitting infection. So the level of disinfection can be low level. Just take a cotton swab, dip it in spirit, put some spirit wipe the area which is touching the patient's skin, the area of the instrument that is touching the patient's skin, then it is free to be used on the other patients. After each patient, just wipe the area with a 70% uh, spirit, okay, surgical spirit, that is fine. Okay, next patient can use it. So that is a low level disinfection. Okay, next is your semi-critical instruments. They enter your body, but they enter the mucous membranes. They are in touch with the mucous membrane. Okay, and if there is any ulcer, any wound in the mucous membranes, that will touch that as well, like your laryngoscope, endoscope, sigmoidoscope, all your fiber optic instruments in which enters your body and you can visualize the interior in a screen. Okay, all the fiber optic devices are semi critical. Okay, they require high level disinfection before it is being used on any other patient. Okay, so all high level disinfections using enzymatic cleaners, okay, bleach solutions, these has to be used to clean these instruments, dry it properly. You cannot sterilize them. If you can sterilize them, it is well and good, but majority of these instruments are heat labile. They cannot withstand high temperature or high pressure. So in that particular category should undergo high level disinfection. But there are some other devices which can withstand high heat and pressure, and they are semi-critical. Don't risk it. Put them in sterilization. Okay. Next is your critical instruments. Okay, they touch the sterile areas in the body, like your organs, blood, other body fluids, in tissues. Okay, these all the operation theater instruments are critical. They require sterilization before they are being used on anyone else. Okay, so that is splodding classification. So here we will see the level of processing you require in the different forms of splodding classification. So in critical, where the risk is high, okay, because these instruments are entering or penetrating into the tissue, in the body cavities, organs, bloodstream, okay, in your blood vessels, they are entering. So your sterilization has to be done. If it cannot withstand high levels of heat, ethylene oxide sterilization is recommended. If it can withstand high level of heat and pressure, autoclaving is done. Okay. In semi-critical, where the risk is medium, okay, where they are touching the mucous membrane, they are touching the wound on the skin, these instruments, medium level of risk is there to transmit infection. But again, divide these instruments into two categories: heat tolerant ones, heat sensitive ones. Heat tolerant ones can go under autoclave, hot air oven, etc. Okay, steam sterilization can also be used, but heat sensitive ones, ethylene oxide, low temperature sterilization, chemical disinfectants, high level of chemical disinfectants can be used. Okay, so examples are respiratory therapy instruments, gastroscopy instruments. Okay. Then non-critical instruments, which has low level of causing infection, non-critical ones. They have intact, they don't touch the wound, they don't touch the organs. Okay. They have no contact with the patient's organs and all, only intact skin. So clean them after each use with either, best is go with spirit. Okay. Second option is detergent water. It's a low level disinfection. Okay. And store it in a clean, dry place. So other factors associated with reprocessing. First is your staff training. In staff training, you make sure your staffs who work in CSSD, they are well aware of the splotting classification. They are trained with splotting classification. When an instrument comes to them, they know where to put this for sterilization or high level disinfection. Okay, your staff has to be trained how to use the uh, sterilization equipments, machinery, okay, appropriate time, setting the time, and all. They have to be trained well. Then appropriate level of processing. Each and every instrument that comes to CSSD should be processed well. If it is broken, if servicing is required, the instrument should be sterilized. Then it should be sent for servicing. When it comes back, again it has to be sterilized, and then it can be put back to use. Okay. Select the items that require special reprocessing, like fiber optic instruments. They definitely require special reprocessing. So keep them aside. Okay. Use a checklist to uh, to follow the guidelines which require for the instruments that require special reprocessing. Storage of equipments. Do not store equipments where there is water or moisture. In closed, dry, cool place, safe place, all the sterilized instruments has to be stored where there is no moisture, no threat of moisture. Okay. And all patient care equipments should be considered. Each and every equipment that touches your patients anywhere on the body, inside, outside, anywhere, any instrument that touches the patients should be considered for reprocessing. Okay. So that's all for today's topic on decontamination and disinfection and reprocessing.